Hello everyone, a little bit about paranasal sinus. This is the coronal section of paranasal sinus, and here you can see the nasal septum here, and you can see the orbital cavity here, and this is your nasal cavity. Between the nasal cavity medially and the orbital cavity laterally you have the ethmoidal sinus. Yes or no? You have the ethmoidal sinus. And in this picture you can see the middle turbinate and inferior turbinate, which is a separate bone. You all very well know the maxillary sinus, the frontal sinus, and in the sagittal section you can see the frontal sinus very well, and you can see the bony structure called as the basal lamina. So, in front of the basal lamina you have the anterior ethmoidal air sinus, and behind the basal lamina we have the posterior ethmoidal air sinus, and behind the posterior ethmoidal air sinus we have the sphenoidal air sinus. And in this picture it is marked AN here. What is that? Agar nasi cell. What is agar nasi cell? It is nothing but this anterior ethmoidal air cell is extending below your frontal sinus. It is extending anteriorly below your frontal sinus. That is nothing but extension of the anterior ethmoidal air sinus anteriorly and inferiorly to your frontal sinus. What happens to the agar nasi cell? If the agar nasi cell is enlarged, it can block the drainage of the frontal sinus. Yes or no? It can block the drainage of the frontal sinus and it can cause frontal sinusitis. Okay, now going on to the question. Onodi cells. What are Onodi cells? So, as I said before, this is your frontal sinus and this is your anterior ethmoidal air cells and posterior ethmoidal air cells, and this is your sphenoidal sinus. The extension of the posterior ethmoidal sinus superior to your sphenoidal sinus is called as the Onodi cells. Posterior ethmoidal sinus extending superior to your sphenoidal sinus is your Onodi sinus. So, Onodi air cells are seen in posterior ethmoidal sinus. So, another picture showing the posterior Onodi cell is, this is your sphenoidal sinus and this partition you see here, okay, is your Onodi cell. That is nothing but extension of the posterior ethmoidal sinus. So, here you can see the optic nerve and the internal carotid artery. So, what happens is, when you are operating functional endoscopic sinus surgery, you can interfere with the optic nerve or internal carotid artery, and that can be life threatening, or there is going to be pituitary here. Yes or no? Above the sphenoidal sinus you have the pituitary, or if you are going to operate on pituitary through the sphenoidal sinus, transendoscopic pituitary surgery, then the interference with the Onodi cell, okay, can injure the optic nerve and internal carotid artery. So, another picture showing the sphenoidal sinus and the Onodi air cell, and one another picture showing the sphenoidal sinus, okay, and the Onodi air cell extending, the posterior ethmoidal cell extending. And what is this diagnosis? What is the diagnosis? So, here you can see the nasal septum, middle turbinate, inferior turbinate. So, this is your anterior ethmoidal air cells. This extension of the anterior ethmoidal air cells into the infraorbital position. This is your orbit. Okay, the extension of the anterior ethmoidal air cells to the infraorbital position is called as the Haller cells. Okay, Haller cells that can interfere with the drainage of the maxillary sinus. So, again one another picture, the deviated nasal septum, middle turbinate, inferior turbinate. So, here you can see the enlarged edematous middle turbinate. So, that is called as a concha bullosa. That is called as the concha bullosa. What are the things you can see here? You can see the anterior ethmoidal air cells you can see here, and maxillary sinus you can see. and one another picture showing the sphenoidal sinus. So, this is your Onodi cell extension of the postethmoidal air sinus. Thank you.